afternoon. Good afternoon. Thank you. Thank you. Please be seated. We are delighted to welcome you to the White House to be part of this very exciting announcement and program. We have a number, well, actually everyone here is a distinguished guest, and we have a number of members of Congress, representatives of many businesses and not-for-profit organizations. We're pleased to have representatives of the states, both governors, governors' spouses, and staff from the National Governors Association. This has been an extraordinary effort that has brought together literally every part of America. And I'm honored to join the President and all of you as together we take another important step forward in our efforts to make quality health care a reality for all of America's children. The progress we've already made would not have been possible without many of you here in this room. I want to thank the Secretary of HHS, Secretary Donna Shalala, for her tireless leadership. I want to thank the two governors who are here with us on the stage, Governor Leavitt and Governor Carper, for making health care a bipartisan effort. And I'm particularly pleased to see a number of congressional leaders. Some are en route, and I believe the President will recognize everyone who is eventually here, but I know that Senator Hatch is here, and Representative Sheila Jackson Lee is here, and others, I'm told, are coming. I'm also delighted that this effort has brought together advocates and business leaders in one common goal to try to make sure that all of our children have the health care that they need. I would like especially to acknowledge the healthcare advocates, the community leaders, the education groups, the business leaders, the not-for-profits, and especially the work of our religious groups like Catholic Charities who are doing such valuable work on behalf of children's health issues today. Nothing better explains why we are here than the story of a woman I just met. Mary Smith is here with her two sons, Samuel Jr. and Thomas, and the Smith family really represent millions and millions of American families. Mary and her husband have both been working, but their employers either didn't provide health care coverage or offered them private coverage they could not afford. So for 3 long and wearisome years, their children had no health insurance. And every single day, particularly on the afternoons when she knew her sons were out playing sports, Mary felt, in her words, that she was walking on eggshells, hoping and praying that nothing would happen to her boys. Now, every parent can imagine how Mary and her husband felt. When our children are sick or hurt, the last thing we should have to worry about is whether we will have the financial resources to take care of their pain, to heal their wounds, lower their fevers, put them back on their feet. Yet as shocking as it may sound, almost 11 million children in America have no health insurance. Thanks to you, and with the support of the President, who made it a priority, and a bipartisan majority in Congress, that situation began to change on August 5th, 1997, when the President signed into law the largest expansion of health care in over 30 years. That day, our nation committed $24 billion to insure millions of uninsured children and their parents through a federal-state partnership. Today, more of America's families, including Mary's, are breathing easier because their children are covered under the Children's Health Insurance Program, known as CHIP. Creating CHIP was the critical first step in ensuring that our children receive the health care they need, from checkups to immunizations to complicated surgery. But we recognized that fulfilling the promise of this legislation would not be done when the President signed it. In fact, that would just be the beginning of the hard work to make sure it could be implemented. At least half of all uninsured children are eligible for federal, state health insurance programs, but too often their parents don't know or don't believe they qualify. As successful, for example, as Medicaid has been, an estimated 4 million eligible children are still not enrolled. Millions of others, like Mary's sons, have working parents and didn't know where to turn for health insurance. Sometimes people lose their coverage when a parent loses a job. Sometimes the long, complicated forms just really seem too much for any family to face. So over the past year, we've carried on a sustained outreach effort in communities nationwide to help educate families about CHIP, and I'm very grateful for the work that all of you have done. I'd like to describe a particularly successful effort. Last November, Chicago's public schools launched an aggressive school-based outreach campaign aimed at the estimated 170,000 students who were eligible but not enrolled in the Illinois Kid Care program. First, they sent out enrollment information to every family who had children in the city's public schools. Then on the day that Chicago requires parents to come to school, which I think is a very good idea, to pick up their child's report card, 3,000 volunteers were on hand to help eligible parents fill out the forms to get their children enrolled. Everyone was involved, from teachers to social workers to counselors, from private corporations to advocacy groups. And they also had advertisements that were public service on the media and the TV and the radio, translated into 5 different languages, including Cantonese and Arabic. And the result of this concerted campaign, about 14,000 children in Chicago applied for kids care during that time period. And I know Paul Vallis, who is the CEO of Chicago's public schools, is here with us, and I want to congratulate him for creating such a model program. This Chicago program shows what we can do when we work together and when we really reach out to families and children to make good on the promise that the President signed into law in August of 1997. There isn't any more important mission than ensuring that every parent has the peace of mind that Mary now has to know her children are insured and has the resources to back up that peace of mind. I want to ask Mary and her sons to stand so that we can acknowledge you, and I know teenage boys hate this, so we'll do it really quickly, Samuel and Thomas, but I want to acknowledge the family. And now it's my great pleasure to introduce someone who has not only placed the issue of children's health at the top of our nation's agenda, but has worked tirelessly to make sure it stays there until we get the job done. The Secretary of HHS, Donna Shalala.
Thank you very much, Mrs. Clinton. Mr. President, distinguished guests, George Will once wrote, "We are given children to test us and to make us more spiritual." It's true that children playing and laughing and hiding and refusing to go to bed do test us, sometimes to the point where a spiritual and probably spirited discussion with our Maker seems in order. Children being children is a test that every parent faces and learns to love. But there's another test that really tries the spirit of millions of working parents, and that's the test of a sick child with no health insurance. We believe that parents should not have to rely just on prayers when their children are ill. They should be able to rely on quality medical care. And as Mrs. Clinton has said, that's what the Children's Health Insurance Program is all about. I want to make this very clear. CHIP is not a welfare program. It is a serious and substantial investment in the health of our future workforce. It is an investment in working families. It is a matter of pure self-interest. We all win when we keep our children healthy and make our economy strong. In just 16 short months, working with the governors and members of Congress, we have now approved 50 children's health insurance plans in our states and territories. Under these plans, states expect to enroll by late next year 2.5 million children. But CHIP is a little like a new restaurant. The tables and the waiters are in place, the doors are open, a few customers come in, but we have a lot of empty tables. And that means getting the word out. And frankly, it means building on the important steps we've already taken to give parents the information and I think the peace of mind that they need to protect their children. Last February, the President had a wonderful idea. He created an interagency task force made up of all the federal departments that serve children. His charge was unambiguous. The President is never ambiguous. He said, find the uninsured children and sign them up. Connect them up with all the programs that you have. And that's exactly what we've done. I'm pleased to report, Mr. President, that the Secretary of Agriculture, Dan Glickman, is reaching families through the food stamp program. Dick Riley at Education is reaching families through the schools. In fact, the First Lady of Maine told me that her children got the notice when they came home from school. The Secretary of Housing and Urban Development, Andrew Cuomo, is reaching families through public housing. Together, the members of the task force have begun over 150 outreach activities last year. And as for my own department, from training grantees to meeting with state Medicaid directors to enlisting the help of grandparents, we've helped lay the foundation for the national campaign that the President and the governors are announcing today. Last fall, we actually teamed up with the National Governors Association to create a regional radio campaign to reach parents about the CHIP program. We've designed posters and bumper stickers and an easy-to-use kit that our partners in both the public and the private sectors can use to teach their members how to find and enroll CHIP-eligible children. And today we're starting a new website, www.insurekidsnow.gov. Gov stands for governors. What the website will tell you is about CHIP eligibility, where to sign up, and all that on a state-by-state basis. Our goal now is to find the parents of CHIP-eligible children and to tell them about the program. Our goal is to get every single one of these children enrolled. I mentioned that CHIP has been a very strong bipartisan effort. In particular, the governors and the National Governors Association have stood with us and worked with us from day one, as have the members of Congress who are here and who are up on the Hill. All of them have worked closely with us. But one of those governors who's here today is so committed to this program that he agreed, Mr. President, to spend some time away from his 9-1 first place Utah Jazz so he could be with us today to talk about CHIP. It's my pleasure to introduce Governor Mike Leavitt of Utah.
Thank you. This nation has made remarkable progress in ensuring the lives of young children in the past 18 months. Today we mark another very important step forward to realize a goal that is the goal of every governor in America, to assure that every child in America has access to high-quality health care. In the state of Arkansas, the governor's home state, Governor Huckabee has spent time going from town to town on television and radio, to the point now that there are 38,000 children in your own state, Mr. President, who have health care who would not have otherwise had it. In the state of Alabama, 850,000 applications were sent in packets with public school children. The result is that 23,000 children in Alabama now have health care who otherwise would not. In New Jersey, letters were sent out, 300,000 of them, in automobile registrations. The result, thousands of young children in the state of New Jersey now have health care who otherwise would not. In my own state, thousands of children. Children such as from the family of Deanne Hansen. She has young children. She's a young mother in West Valley City, Utah. Her husband is a mechanic, works hard every day, but employer does not provide health care, and to stay home with her children, she provides daycare in her home. For the first time, she reported it to me, I'm able to take my children to the dentist to have a checkup and to have their teeth cleaned, and I go to bed at night without the worry that my children will get sick. 48% of the children in my state who have received health care are from rural communities, Mr. President. I say that with only 12% of our children in rural areas, so that's disproportionately benefiting rural communities in our state. And we intend to reach out. And this number, this 1-877 Kids Now, will literally result in children every day receiving health care. We're running the radio ads, and you can see literally an immediate response. We run the radio ads, children sign up. So we, with great enthusiasm, look forward to expanding health care so that every child in every state will have access to high-quality care. It's my pleasure now to introduce to you my colleague who had a great deal to do with assuring that this passed. He's moving it forward in the state of Delaware, the chairman of the National Governors Association, Governor Tom Carper of Delaware.
Well, I got two speeches here to read. One of them are my notes, and the other says presidential statement. I'll stick with my notes. Mr. President, Mrs. Clinton, Secretary Shalala, and to my friend and colleague Mike Levitt, joined here by governors and spouses from other states. I'll probably miss somebody here, but I'll mention a few of those. The Kings are here from Maine, and the Vlasics from Iowa. I see someone who looks like they're back there from West Virginia, and a couple of folks from Alaska, Puerto Rico, and for others that are here, I apologize. Those are the only ones that I see. But thank you for joining us and for being our partners. I want to start off by sharing with you a story. I think my neighbor from Pennsylvania here, Senator. How are you, Senator? Representative. I want to share with you a story that I heard years ago from a guy who served with in the Congress. Maybe you remember Bill Gray from Philadelphia, and who now heads up the United Negro College Fund. He used to tell a story. Maybe you've heard it. It's about a bunch of kids that are playing in their neighborhood, and they're playing around an old well, where people used to get their water out of. And one of the kids sort of leans over and literally tumbles into the well and falls in and survives the fall and is splashing around down at the bottom and calling for help. And the other kids who've seen it all become excited and run back home to tell their parents and everybody what's happened. Quickly, people come running from homes in the neighborhood to see what's wrong and see the kid in the well. And they rush back to their homes, to their garages, and to their basements, and they all get a rope. And they bring their rope to the well and fashion these knots, and then one by one lower their ropes into the well. And nobody has a rope that's long enough to get to the child in the well. And one of the kids comes up with this bright idea: why don't we tie our ropes together and fashion a community rope and lower that rope down into the well? And that's what they do, and they raise the child to safety. Now, I don't think that's a real story about a real person, but it's certainly a story that has a real point and meaning for us here today. There are a lot of kids in that well, for no fault of their own. They have literally live in a family where somebody's working, but they either don't make enough money or their employer doesn't provide health care for that family, and they need our help. They need our help as a community. And what we've done is, and we've just had a meeting of the National Governors Association. You all have been terrific to host us here and to be a part of this meeting. But the overarching theme, our focus as governors, is raising student achievement. But the overarching theme for this meeting in Washington was progress through partnership. Progress through partnership. And I just want to mention some of the partnership that's occurred here to make this day possible and get a lot of those kids out of that well. First of all, the vision. Vision provided by our President and our First Lady, the vision provided by our Secretary of Health and Human Services, the vision from our Congress, House and Senate, Democrat and Republican, the vision from our governors, some of them who are here today, and from our spouses who have been very much involved in this. But first the vision, and then secondly the dollars, federal dollars, a couple of the state dollars to make possible the expansion of this health care. And then finally, the message, getting the message out to families so that they'll know that this new benefit exists for kids. I don't know if you ever heard this. When I was a kid, I remember somebody once asked me, it's sort of a rhetorical question that it took me years to try to figure out. And the question was it's, if a tree falls in a forest, remember this one? If a tree falls in a forest and nobody is there to hear it, is there a noise? If a tree falls in the forest and there's no one there to hear it, is there a noise? Let me just sort of change that around a little bit. If a terrific program is created, envisioned, and funded, and provided for our young people in our country, but they never hear about it, is the quality of their life improved? Is their health care improved at all? And obviously the answer is just no. Well, we're here today to help get the word out, to make sure that when that tree falls in the forest, there's a loud noise and a joyful noise, and a lot of children are going to benefit from it. I just want to say, Mr. President, Mrs. Clinton, thank you for using your bully pulpit and giving us the opportunity as governors to use this bully pulpit to get the word out. To all of our friends in Congress who are trying to get the word out, to the governors and spouses who are trying to get the word out, especially to the National Governors Association, which you once led, which Governor Leavitt will now serves as the vice chair and I serve as the chair, but for coming up with the idea of this hotline so that kids and families all over the country can literally have a new, not an 800 number, it's actually a different kind of a number. I want to say an 877 number, where people across the country can pick up their phone, dial 877, and if they live in Utah or they live in Delaware or Alaska or Maine or any other state, they can call that 877 number and get hooked up right away with somebody in their state who can help say, this is how you can get signed up for health care for your family. You might be eligible, and we want to get you the forms, and this is how to do it. That's a great way to outreach, and I'm grateful to the NGA and to our Center for Best Practices for sort of coming up with that idea and for us having the chance to push it. Last thing I want to say, a lot of cameras here today, a lot of media here today. And in terms of getting the word out, you're just critical. And we can be real creative in Chicago or Arkansas or other states, but you know something? The media, in terms of your ability to connect with the people that are reading our papers or listening to the radio stations or watching TV, your role is just enormous, and I would not underestimate that for 1 minute. We need your help. The last thing I want to say is, I'm sure everybody in this room cares a lot about kids, loves kids. I don't know of anybody who cares more about kids and loves them any more than our President and First Lady. Mr. President, you do a whole lot more, and Mrs. Clinton, you do a whole lot more than just talk the talk. You walk the walk. You provide the bully pulpit, you use the bully pulpit, and maybe just as important, maybe more importantly, you're willing to put our nation's money, our dollars, to invest them in things that you believe in. And as a result, we got a whole lot of kids today who are alive because we've driven down the rate of infant mortality. Got a whole lot of kids today who somebody's working in their family and they're coming home from school, or maybe they're not old enough to go to school, they got some decent child care. Got a whole lot of kids today that got to be in a Head Start program and get a head start on life. Got a whole lot of kids in this country who are going to get a better education because of the great champion that you've been and continue to be on our school reforms and raising student achievement. And you know what else? We're going to have a lot of kids that are growing up as healthy, young men and women and have a life, a healthy life, because of the opportunity that they will have through the expansion of this program. And because today and in the weeks ahead, we let them know that the program exists. I'm honored to present to us all today the resident, one of the two residents of this place, our president and our chief executive, the president of this country, Mr. Clinton, Bill Clinton.
Thank you very much. I wish you had. Thank you. Thank you very much. Thank you. Thank you. Thank you very much. Let me begin by saying how very much I appreciate all of you here who are a part of this historic day. I thank my longtime friend, Governor Carper, for his generous remarks and his great stories. He almost broke my concentration, though. I'll spend the rest of the day trying to remember what my first answer was to whether there is a noise when a tree falls in the forest. I thank you, Governor Leavitt, for your outstanding leadership and your concern for our children. I'd like to again acknowledge the presence of Governor Angus King of Maine and Mary Herman, Governor and Mrs. Knowles of Alaska, Governor Vilsack of Iowa, Mrs. Rosselló from Puerto Rico, Mrs. Underwood from West Virginia. And I thank all the members of the Governor's Conference who are here. There's one private citizen here I would like to acknowledge, and that is Bud Childs, the son of the late Governor Lawton Childs of Florida, who has been very active in this endeavor as well. I thank him. And we have a distinguished bipartisan delegation from the United States Congress here, Senator Hatch, here supporting his governor from Utah, Senator Specter from Pennsylvania, Congresswoman Diana DeGette from Colorado, Congresswoman Anna Eshoo from Northern California, Congresswoman Sheila Jackson Lee from Texas, Congressman Bart Stupak from the Upper Peninsula of Michigan. He is the only person in the room who thinks it is warm outside today. We are, I'd also like to thank the Smith family for coming, and I hope the boys weren't too embarrassed to stand up, but they look very healthy to me, and that's reassuring. And I'd like to thank these beautiful children for being here, over here, and their families. And, when you think about what this is all about, just kind of look over there. I want to thank the National Governors Association. I want to thank Secretary Shalala, who is indefatigable. If I ask her to do something, sooner or later I will come to regret it. Because she will do it, and I will wind up doing whatever it is I'm supposed to do to make sure it gets done. She is not only the longest serving person in her position ever, she is also the most energetic, and that is no disrespect to her predecessors. I have never known anybody with as much energy as she has. With the possible exception of her mother, who I understand is still winning tennis tournaments in her 80s. I'd also like to thank the First Lady, without whom I probably would not know very much about these issues. When I met her in 1971, she was already obsessed with them. She took an extra year when we were in law school to work at the Yale Child Study Center and the Yale University Hospital so that she could put her legal learning to work to help the health of our children. And when you talked about our home state having 38,000 people signed up, we have less than 1% of the population. That means if everybody was doing that well, we'd already have 4 million kids signed up for this program. And that is in no small measure due to a group called the Arkansas Advocates for Families and Children, which Hillary founded over 20 years ago now. So I thank her for all that she has done. When the Congress passed the bipartisan balanced budget in 1997, it was a truly historic act, and most of the publicity that surrounded that endeavor came from the sheer relief the country felt that finally we had done something about the deficit. But it's important to point out that there were a lot of very important provisions within that very large law, but none more important than the $24 billion allocated to provide health insurance. We estimated at that time to up to 5 million kids, which we estimated at that time were about half of the uninsured children in our country. It is inconceivable that a country with as much economic prosperity as we now enjoy and the best healthcare system in the world would leave 10 million, now nearly 11 million children without health insurance. We know many of them are eligible for Medicaid, but their parents don't know it. We know there are a lot of hardworking families now whose incomes are too high to qualify for Medicaid, but they apply or qualify for the children's health insurance programs now that the states are operating around the country. But they don't know it. Now, we knew when we signed this law into effect, I'll never forget Donna Shalala telling me, she said, you know, we can pass this law, but we've already got, at that time, over 3 million kids eligible for Medicaid who don't sign up and don't know it. So we knew then that to make the tree herd in the forest, to extend the governor's metaphor, to make the health insurance program more than an empty promise, we'd have to somehow get the word out to parents. Last week, you've heard all these stories. Last week I had an incredible experience at a healthcare forum in New Hampshire. I met a woman named Christine Montero who has run a small business with her husband, a solar energy business, for 11 years. And like all small businesses, she had her ups and her downs. But the hardest times came when her kids needed health care and they couldn't afford the health insurance. She found out about it the way we don't want people to have to find out about it, even though better that she found out than not. She had to take repeated visits to the doctor with her child. And finally, a health care worker at the medical clinic told her that she might be eligible for New Hampshire's CHIP program. She applied immediately, found that her daughter's visits were all covered, and she saved up to $1,000 a month for a very serious illness for her child. Christine and her family were lucky. Not everybody, even who would come into a medical facility, might know. This should not be a matter of luck. We're here because all of us in our various roles in life recognize that we have an obligation to use every possible tool, every possible response to reach more of the hardworking families like those you've heard about and seen today. Government has a role to play. Secretary Shalala talked about it. Our national campaign is called Insure Kids Now. We've already heard about the remarkable National Governors Association effort, working with our administration in Bell Atlantic, the national toll-free number. I'm going to say it again. I like to say toll-free numbers. You know, there's some chance it'll get on television if I say it. One of the few things I can think of that'll say it's subject to absolutely no controversy. If I could stand up here for 10 minutes, just repeat the toll-free number, you know. I'll say it again, 1-877-KIDS-NOW. Not hard to remember and important not to forget. As you heard, because of the work of the NGA, you can get state-specific information. Because when the Congress set this program up in the Balanced Budget Act, we strongly supported this. We realized that we couldn't possibly design a program in Washington that would cover all the different circumstances that existed from state to state. So all these programs were set up and then approved state by state. So this is very, very important that we get this information out to people in the form in which it is most usable. And again, I want to thank Governors Carper and Leavitt for their leadership during this critical past year, and all the other governors for their support. Secretary Shalala told you about some of the things we're doing at the federal level to reach more uninsured children. But let's be frank, to reach them all, everyone who can touch the life of a child or the child's parents needs to be involved in this effort. Today, we're here to announce an unprecedented commitment from media to business, from the healthcare industry to grassroots organizations, all over our nation to inform families of these new health insurance options. We began with an all-out media campaign to reach as many families as possible. NBC is unveiling a new primetime PSA to raise awareness about children's health insurance programs. Patha Murkinson, one of the stars of NBC's Law & Order, who appears in the PSA, is here with us today. Thank you very much for being here. Thank you. Thank you. ABC and Viacom Paramount will soon begin airing a PSA the First Lady made to inform families about the Insure Kids Now toll-free number. They have representatives here. I thank them. The National Association of Broadcasters will make the First Lady's PSA available to all of its member stations. Black Entertainment Television and Turner Broadcasting will also run the ad. Before I go forward, I'd like to just unveil the two PSAs here for the first time. Let's take a look at them.
As parents, we work hard to give our kids the things they want, like a bicycle or a dog. But even more important is giving them something they need, like health insurance. Unfortunately, many parents think they can't afford it. But through a new initiative called Insure Kids Now, your children may be eligible for free or low-cost coverage. To sign up, call toll-free 877-KIDS-NOW, because every child should be covered.
You know, there are a lot of things that parents want their children to have. At the top of the list is good health.
And sometimes finding the money for the prescriptions or doctor bills isn't easy.
But you know, now there's a new program that provides free or low-cost health care to the millions of American children without insurance.
To find out if your child is eligible and to enroll, call toll-free 1-877-KIDS-NOW. Because doing the best for your kids means what?
Keeping them healthy.
Keeping them healthy.
I'd also like to thank the representatives from Univision here. They will run a PSA in Spanish made by HHS. And we're not stopping there. Major corporations from Kmart and Ralph's Grocery to McDonald's to General Motors, from the American Medical Response to Blue Cross Blue Shield Association to Pfizer, all of whom are represented here, will help make sure that the Insure Kids Now toll-free number appears on grocery bags and restaurant placemats, on school buses and in doctor's offices, even on the toothbrushes that dental hygienists give their patients. And with the help of organizations like America's Promise, the United Way, and a host of community-based groups, families will hear about health insurance from the people they trust the most, from teachers and principals, doctors and nurses, rabbis and ministers. Ultimately, of course, parents must take responsibility for their children's health. Our message must be, what you don't know about your children's health insurance options can hurt them. It's up to you to find out if your child is eligible for this health insurance. So call the toll-free number, 1-877-KIDS-NOW. Working together, we can reach those kids. Look at those kids there. There's over 10 million of them. They deserve to be as healthy as we feel today, and we can do it for them. Thank you, and God bless you.